Hi, a very good evening to this August gathering here. First off, I'd like to congratulate everyone that's a part of this platform, and thank you so much to the organizers for having me here. As a 26-year-old young woman, it's very inspiring for me. It's like a ray of hope to know that there are people who are working in this field, in women's health, and that we're going to have a brighter future. So I'm being told that we have very little time, so I'm going to make this as crisp as possible. But in case you wish to connect with me later, we can always do that. So DigiSwasthya Foundation, like Ms. Ane also said, that people who are working at the grassroots are working on awareness, accessibility, affordability. That is also something that we are doing at DigiSwasthya. And DigiSwasthya essentially means digital health. So that is the mission through which we're trying to provide healthcare services. Let me start with the story from the grassroots. This is the story of Ms. Ranjita, who is a 35-year-old female who was diagnosed with breast cancer. And this is in the rural district of Sant Kabir Nagar in Uttar Pradesh. When she went to the local hospital, she was told that there aren't any doctors who can perform the surgery that she needs. And that's when DigiSwasthya stepped in. So she came to us for a second opinion with Dr. Rakesh Mittal, who then referred her to the hospital in Varanasi. After the advice that she received, she underwent a couple of cycles of chemotherapy, had a surgery, and today she's running her own business in the village, supporting her family. But this wasn't always the scenario. In 2007, a young 13-year-old named Sandeep also suffered from cancer. He was diagnosed with sarcoma, but this was only after 6 months of running from post to pillar in search of the right diagnosis. This story is also from Sant Kabir Nagar, the same rural district. And that's when he realized that there is a dire need of having a structure in place wherein folks from the villages can visit and get themselves diagnosed, receive the right diagnosis at the right time, along with the right medical advice. So that's when he thought about starting DigiSwasthya Foundation. And currently, it's an NGO that's 2 years old. We're registered as a Section 8 organization. And we're delivering quality healthcare services via tele consultations, awareness camps, and referral pathways to the remotest parts of India. I think we've already discussed a couple of problems, the gaps that we see today in the primary healthcare system. And some of them were, gaps in data, gaps in people working at the different strata of the healthcare system. There are fragmented communities, fragmented systems, and there is a lack of unified platform in this field. But if I move more towards the rural areas, what we see over there is that there is a lack of qualified doctors. So the people in the villages, they prefer going to a quack rather than a registered medical practitioner. You might say that there are primary healthcare organizations present at the grassroots. There are PHCs, CHCs, yes, but they suffer from a rampant absenteeism of doctors. So if you ever visit a PHC, I'm sure you're aware of the conditions that you get to see over there. This often leads to an inferior quality of care and forces the people from the villages to visit the local hospitals in the nearby cities. This, in turn, leads to a higher economic burden that they have to incur. So currently, we're setting up these phygital telemedicine centers, a mix of physical and digital. And these hybrid centers are in the villages that are providing electronic medical records, digital prescriptions. We are providing awareness through camps in local languages, critical illness care, and of course, referral networks with the hospitals nearby. So through this phygital approach, we intend to make our solution as inclusive as possible because at the village level, there is a lack of digital literacy. So while there are a lot of people in this space who are working on various solutions that incorporate tech, they often tend to dismiss the fact that people at the village might not be able to utilize it. So there are some great solutions out there, but we need to find out how to make them more approachable, more accessible. And we're trying to do this by empowering the people which are, belong to the local youth communities in these villages. So we are creating healthpreneurs. We are empowering them with the skills that they need. This is basic medical training. There are systems available at the government level. There are schemes, there are training programs that you can use to upskill these healthcare workers. We're trying to work with healthcare professionals across India, across specializations, and of course, partnerships in this ecosystem to help us reach our mission. These are some of the doctors that we have on board, and as you can see, they belong to some of the esteemed institutions in India across the country. Our impact so far in the past 2 years, we have managed to facilitate 17,000 teleconsultations, and this is through the 5 phygital telemedicine centers that we have in India. We also conduct camps elsewhere in India, apart from the places where we have a presence phygitally. We have partnered with diagnostic centers and also hospitals, pharmacies. We provide second opinions, we provide COVID consultations, and so far we have empaneled 130 plus healthcare professionals, of which there are some dietitians, nutritionists, and also mental health experts with us. These are some images that you see from door-to-door campaigns in the villages. We also have health camps and virtual webinars or awareness sessions, which are conducted in the local languages to make it more accessible for the people of the villages. On the left top corner, what you see is a typical DigiSwasthya telemedicine center setup, wherein you'll see a TV screen, a laptop, a patient navigator sitting beside the patient and facilitating the entire process. So when a patient walks into a DigiSwasthya telemedicine center or comes to us through a camp, they are greeted by a team member of DigiSwasthya called a patient navigator. This person is responsible for noting down all the vital metrics, and then they convey it to the doctor who is sitting across the screen. All of this data is then conveyed to the doctor provides their advice, but this is not where the loop ends. We also ensure that the patient knows what the next step is. Whether they need to go to a pharmacy, a lab, or a hospital, we ensure that that referral is provided to them. We also follow up with our patients because lack of patient compliance is, again, extremely high when we look at these kind of settings. So it's important for us to ensure that the patients are adhering to the treatment that has been prescribed to them. We have 2 centers in Uttar Pradesh, 1 in Bihar, and 2 in Maharashtra. And the USP that our organization has that we are trying to connect the patients to the kind of doctors that they might not normally have access to. So a patient who is in a rural village of a district like Sant Kabir Nagar might not even dream of consulting with a doctor from, let's say, Tata Memorial in Mumbai. But we are making that happen, and fortunately, the doctors that we have on board are doing this at a pro bono basis. So they charge anywhere between 50 rupees to 250 rupees per consultation. This is the core team that's helping us achieve this dream. And we have so far managed to accumulate a cumulative savings for 17,036 patients, which amounts to about 3.6 crores. This is just a comparative analysis of how much time and money a patient saves if they visit the local DigiSwasthya telemedicine center versus if they have to visit the local hospital. But these numbers are not just numbers. These are real lives, they're real stories. And with the consent of our patients, we collect these stories to share it with people like you and I. This is our advisory board, and we previously heard from Dr. Sabine, who has been a great mentor to us. These are some of the donors and partners that we have on board, and we are looking out for more partners. So I'm hoping that after this conference, a lot of us can collaborate, because I see there is immense scope for doing that. These are some of the notable awards and achievements, a recent one being a 10,000 USD grant that we received from Bill and Melinda Gates Foundation, FICCI, and ADPC. We have been incubated by IHMR startups and AIC RMP as well. This is some of the media coverage. And this is what the future roadmap looks like. So currently, we're in our 3rd year of operations, where we are focusing on sustainability over scalability. But by the 5th year, we aim to set up 15 new telemedicine centers. And this is where you come in. So what you can help us with is that we can partner to set up these telemedicine centers in your village, in areas where you operate. We can help each other by collaborating when it comes to, let's say, market access or research. You might have a solution that you think works quite well, and you might want to pilot it. So DigiSwasthya could be an implementation partner for you. We also want to work on creating these support networks so that International Women's Day is not the only day when we're talking about these problems. We want to reiterate and keep having these conversations through platforms like this one. That's about it. Thank you so much for hearing me out.
Do we have any questions?
Thank you, Dr. Pallavi. Thank you for the work that you're doing and also for the beautiful and concise presentation. So we started off the day with saying that today is the day of universal health coverage. And we also had Dr. Reddy's presentation. So I just want to know that from your experience of working in the rural areas that you mentioned, what would be maybe one or two things that would be a recommendation to the government or the policy makers that they need to pay heed to when they are considering a universal health coverage in the Indian context?
Yeah. That's a great question. Thank you so much for that. Honestly, I would say I'm too young in this field to, sort of give recommendations, but from my lived experiences and that of my team members, so my entire team is from the villages, and I'm very happy to share that 50% of my team is made up of women. So they often share the problems that they encounter, and what I have seen is that while there are a lot of health schemes, what's lacking is documentation. So there are so many folks on ground who don't even have an Aadhaar card. And that is one of the basic things that you need to just have access to this universal health coverage. So there are schemes like there's Ayushman Bharat, but how many of us know the list of documents that are required? So there are so many cases where we have to, just encourage the family to get all the documentation in place, and that often takes a lot of time. So I think if we were to have centers in place that could just guide these patients through the process. And I understand that's a tall ask because there are so many of us, right? So many of us looking for support. But if there were a localized effort to bring this awareness into these local communities, I think that would help a lot. So someone like a navigator to help them through this journey, to just accompany them through challenges that they encounter. Yeah.
Any more questions?
Okay, really, thank you so much. It's great to hear, and also Sania's presentation. Perhaps a question to both of you is, a big part of your offering is also to work with healthcare providers. And we know that there are large and a heterogeneous population. And the uptake and the potential for scale that both of you are looking at is in part depends on their uptake, their education, and convincing them that this is something that will increase their efficiencies, will increase their patient flows, their, the effectiveness with which they're doing their work. How do you do this, both in the public healthcare space as well as in the private healthcare space?
Right. I'll admit it's a challenge because we do see a dropout rate when it comes to these doctors who have been volunteering with us. It's a burden for them. It's overwhelming for them. They already have these long queues in their clinics, in their hospitals, and they don't have the time to volunteer with every organization that reaches out to them. So we try to create this schedule, and we try to tell them that it's going to be a flexible engagement wherein we let them know in advance when they're going to have a camp, and we let them know that, okay, this is the time slot that we would need you to be available for, and yeah, that's how it works. So there have been times where doctors have asked us to increase their fee, and it hasn't been possible for us, and unfortunately we had to discontinue that engagement. But we are looking for more doctors who would want to support us in any way possible, and a big part of that, I feel, is fundraising. So I think Sania, if you would like to just add to that.
Like as you did rightly point out that the challenges increase massively when you're trying to go into a space that is not much experienced in such resources. So when I speak about rural India, basically you can find a concentration of healthcare resources and infrastructure being limited to the urban areas. It's not there in rural area. But also, as we are working in the field, we have seen a wave right after COVID that yes, people are now adopting villages. There are over, like where I'm just working with one company that is Nokia in their CSR, and they've adopted over 200 plus villages in just like few months. Similarly, working with different companies who are adopting certain villages, the rate of that is highly increasing every single day. And as we speak, there are more and more such villages, such village centers being opened. So kind of the awareness is now being pushed towards these particular remote settings. So I kind of feel that that kind of a trend is really good for companies like ours. I think she's into non-profit. We are a for-profit company. But the kind of the awareness that is now being brought towards this particular landscape, that just removes the kind of challenges.
I have a follow-up question for both of you. Both of you are working with the NITI Aayog, and the NITI Aayog should be opening windows that they are connected with ministries, including ministries of with the Ministry of Health, and of course the programs there. So, has there been opportunities for you then to work with the Ministry of Health to position your fantastic offerings, at least in a pilot mode, with the public healthcare system? Like, have you asked that? I'm sure you've asked that question. I'm really curious to know what the response has been.
So far, there have been meetings, but there hasn't been progress, so to say. Yeah. No, that's fine. That's okay.
Yeah.
Yes, that's the hope. That's fair. Yes.
Yeah. Well, actually, I think I do have a contrasting kind of an experience on that. We were like this for the first 1.5 years. We didn't get any pilot opportunity, and all we were asking for was free pilots. That just take this device, do some health camps, and then we had to go to the market ourselves. However, when it comes to NITI Aayog, I think we've had an immense kind of a support from them. Now, I'll tell, like, if I might just take 5 more minutes. So when we started building this device, we knew that we are now making a complete software package, complete hardware package that is literally going to run a particular health center, telemedicine center, rural fever clinic on automation. It was not easy to create it just because of the prices that are there of medical apparatus. We were initially making the product for 45,000 when we started doing the R&D. We went to NITI Aayog, and there was the senior advisor, Dr. V.K. Saraswat, who was a senior member to NITI Aayog. We met him in one of the conferences that was happening at AIC. And then I personally gave him a letter. That kind of, I believe that I'm under the valley of death, and my startup might just succumb because I'm not able to find opportunities. And I'm not even looking to generate revenue right now. I'm just taking 4 years for simple R&D, pilot, and market case studies, like retrieving them. And then he referred me to this particular medtech zone. Now that medtech zone was partially responsible for us to be able to bring down that price and then now again reoffer it in the market. So NITI Aayog, I think they have all kinds of connections in the industries, but it also kind of like relates to, are those pilots currently being, like, are they supporting startups like us who are just so early stage? I think because my company is just 2.5 years old, and I think
Yes, 2 years for us.
So there are kind of a lot of eligibility criteria that we don't fall into, but I think with limited support that we've gotten, I think it's good to start with.
Thank you, and we'll take this as the last question.
Thanks. Pallavi, that was great to know about the work you're doing. I'm from Care Mother, and we burnt our hands working with the public health system,
Yes.
but we are still trying. What my question is that, since you work in rural areas, are you consciously picking up blind spots where there is no public healthcare access or primary healthcare centers? And if you're not, then what is your experience? Like, what's the local reaction? Because you are actually a parallel system.
Right.
So is there animosity, or do you see a lot of referral coming in from the PHCs? I'm just curious to know about that.
Sure. Thank you for that. So there are ways in which we can work with the existing system, and that is the goal. We want to incorporate our solution with what already exists. However, the challenge is that these resources are often underutilized, and we don't have access to them. So like our Pune center, for example, I mean, it's a village near Pune in a district called Tekwadi. So, district called Khed, the village is Tekwadi. Over there, we have set up the center with the sarpanch of the village. And that has been quite successful because, a local leader is supporting this mission. So that brings in more people, and that also creates rapport, builds trust. That is another reason why we are utilizing the local youth, because we don't want them to run to the cities, at every opportunity that they get. We want to create these local employment offerings for them in their own village so that they don't have to abandon their families and go and work elsewhere. When I talk about how the reaction has been for these villagers, it has taken us a while to get to 17,000 teleconsultations. And I must say that it started out very slowly. Initially, we were doing, we were getting anywhere around 200 teleconsultations in 2 months. However, now the footfall is 200 teleconsultations in 2 days. So that's a drastic jump that we have seen, and that has happened through awareness. There were people in Bihar, in this district called Muzaffarpur, where they were actually scared to see, moving images on the screen. And in fact, our own team members, a lot of them didn't even know how to use a laptop. They didn't know how to start it. So we had to teach them everything from scratch. Having said that, I think there is a lot of potential. So, these are people who are very passionate. They want to do something for the community. They're driven. So every time you try to teach something to them, you bring in different technology, they are willing to work for it. And again, I think that not burdening the ASHA workers or the Anganwadi workers, and instead utilizing the youth of the community is a great idea. So I do attend a lot of pitch fests, and I see that every health tech solution, they want ASHA workers to be their implementation partners. That is just not possible. They are so burdened with what they're doing, and we already know what their pay scale is like. So I'm happy to say that at DigiSwasthya, we have generous donors, and we are being able to provide some support to these people who are volunteering with us, who are working with us, at least provide them with the stipend. We do have an Anganwadi teacher who is one of our team members, and she's working with us part-time. So that's just to say that, yes, we should have local leaders from the community, but at the same time, don't burden them with the tasks of your startup. Yeah. Okay. Thank you so much.